So hello everyone. As I've just said to people who have just who came in a little bit early, we're just going to give it another minute or so before we start. But my name's Adam Hug. I'm the director of the Foreign Policy Centre, and this is a part of a on-running series the Foreign Policy Centre is doing with the Aston Centre for Europe of events that were previously held in Parliament. But we are taking advantage of the move to Zoom and Facebook Live so that we can talk to people around the world, both in terms of our panel participants and our audience. So I think we'll sort of begin to get underway, and people will come in and either watch us on Facebook Live or via Zoom. So, as I said, the event we are here today to discuss is the theme of COVID-19 in Southern Europe, lessons from Italy and Spain. We are delighted to bring together a range of experts, both from the coalface and from academia, and in Alberto's case from the British Parliament, to discuss some of the important lessons that came out of the COVID-19 crisis, which hit Italy and Spain so hard before making its way here to the UK. So the panel I'm joined by today is Davide Vampa, who is lecturer at the Aston Centre for Europe, Juan Luis Sanchez, who is the co-founder of El Dario, Alberto Costa, who is the chair of the all-party parliamentary group on Italy, Peter Lachman, who is the chief executive of ISQA, and Mihaela Largina, who is the clinical risk management at La Spencer Public Hospital. Thank you so much for your time here today. We're going to go through the panelists in turn, and then we will be starting audience Q&A. If you want to use the Q&A box that you'll see on your screen in front of you to ask questions that we will pick up after the speakers have made their opening remarks, that will be wonderful. There is also the chat function, but it'll be much easier for us to see the questions if you put them in the Q&A box rather than the chat. So without further ado, I'll hand over to Davide to start off today's discussions. And if we can remind panelists, if we can keep opening remarks to 7 to 8 minutes, maximum 10, and then we will have enough time to have a good round table discussion with audience questions. So take it away, Davide.
Okay, thank you very much. Okay, can you hear me? Yes. Thank you, Adam, and thank you, Foreign Policy Centre, for organizing this event in collaboration with Aston Centre for Europe. I will try to be brief, and I'll go straight to the main theme of the event. I think we can draw some lessons from an analysis of the Italian and Spanish cases, particularly if we consider the territorial dimension of the pandemic. Here I will focus more on the first wave, since the second wave is still ongoing and it is too early to comprehensively assess its impact. Cross-national comparison during the first wave have tended to focus on national level aggregate data, while within country territorial distribution of infection and, more importantly, of mortality has been generally overlooked. Yet, if we look at mortality, this indicator varies significantly across countries, as we know, but also within countries. For instance, in Germany, Germany had a low overall mortality, as we know, but it also had relatively low regional variation in the number of deaths, meaning that the negative impact of the pandemic was quite homogeneous across its lender. In the UK and France, we observe high mortality as well, but low territorial variation. This was true at least during the first wave, although things might have changed. However, even if more territorial differences have emerged in the UK and within England in particular, and of course that's the debate of the current days, in more recent weeks, this variation that we find in England is not as big as in Italy and Spain. Both Southern European countries experienced a severe crisis at the national aggregate level, yet also regional variation in the impact of the pandemic was much greater in Italy and Spain than in the other three countries that I mentioned earlier. Italy in particular has the largest variation in deaths among the 5 countries. And at the peak of the pandemic in the first wave, some of its regions like Lombardy, as you probably know, were overwhelmed, while others, like Sicily, were only minimally affected by the pandemic. So the territorial dimension of the pandemic is, in my view, particularly important. If we look at these 5 countries, so the ones that I've just mentioned, we see that there were clear attempts by national governments to centralize power. This, however, triggered different territorial policy dynamics. In France, the central government did not meet any significant obstacle, and a hierarchical model of crisis management was easily established. In Germany, the federal government played a central role in crisis management, but the Länder, the German states, despite some tensions and centrifugal pressures, generally pursued a cooperative strategy of compensation through participation when responding to centralizing pressures. The UK, as we know, emerged as a hybrid case, given its mix of devolution arrangements in Scotland, Wales, and Northern Ireland, and centralized institutions in England. In Spain and Italy, centralizing tendencies were met with resistance from regional governments, thus reinforcing the competitive character of central regional relations in those countries, in Italy and Spain. So the cases of Italy and Spain point to the fact that it is perhaps too simplistic to just look at centralization and decentralization as two clear-cut models of governance. Decentralization just tells us how power is territorially distributed at different levels, but it does not tell us anything about how different territorial levels interact. Both Italy and Spain can be regarded as more decentralized than France and the UK, at least if we look at England in particular. But so can Germany. So also Germany is quite decentralized. What makes Italy and Spain different from Germany, in my view, is the level of territorial coordination existing or not existing in the case of Italy and Spain between central and regional governments. In my view, the highly competitive and fragmented system of governance in these two countries explains why they have both performed rather poorly. So now I present a brief overview of what happened in the two countries after the start of the pandemic in order to understand the weaknesses of uncoordinated decentralization. So when the pandemic started, Italy and Spain relied on a much more decentralized system of governance than, say, France or England, particularly in the health sector. In fact, in both countries, healthcare is a core policy responsibility of regional governments. In both countries, decentralization was achieved by transferring significant policy-making authority to regional governments while keeping fiscal authority fairly centralized. The strengthening of the regional level, however, was not accompanied by robust formal or informal mechanisms of territorial coordination. Therefore, Spanish regionalism has been characterized by low intergovernmental cooperation and vertical integration and rather conflictual relations between regional and national authorities. Italy is also characterized by high levels of vertical and horizontal territorial competition. Central governments in the two countries slowly started taking some actions in late January and early February when the pandemic just started. For instance, on January 31st, a state of emergency was declared by the Italian government. This was based on the Civil Protection Act of 2018, which is a statutory rather than constitutional provision, which empowers the government to adopt any necessary measure within the limits of the general principles of the legal system. In Spain, in January, the Central Ministry of Health activated the COVID-19 protocol in coordination with regional departments of health. However, these initiatives did not really erode the autonomy of regions. And when the real emergency started, there was quite a lot of confusion about the allocation of responsibilities. Since healthcare is one of the core policy responsibilities of regions, regional governments in both countries immediately found themselves at the forefront of the response to the outbreak. Central governments in Italy and Spain initially acted cautiously and incrementally. In Italy, the regional institutional arrangements of the Italian state emerged as a key dimension affecting the nature of government response. with important emergency initiatives organized very differently from region to region. In Spain, the first closure of schools and cultural institutions were decided in a very uncoordinated manner by the regional governments in Madrid, Basque Country, and Catalonia. Only at a later stage did the central government take direct action and call for the closure measures to be applied to all regions. School closures were also at the center of the debate in Italy, with regional presidents at the beginning of the pandemic accusing the Prime Minister of failing to provide clear guidelines applicable to the whole country. Centralization eventually was regarded as the only solution in an increasingly uncertain context. In Italy, the central government first passed an emergency decree imposing a regional lockdown only in Lombardy and surrounding areas on 8th of March, more than 2 weeks after the start of the pandemic. After only 1 day, on 9th of March, this was followed by another decree enforcing a national lockdown. These decisions were made without truly consulting the regions. However, the inherently conflictual characteristics of territorial institutional arrangements in Italy did not allow the central government to simply act unilaterally and impose its authority, as happened, for instance, in France, or let's say also in England. In fact, after passing the decrees, ministers in Rome had to renegotiate everything with the regions, leading not only to very confused institutional communication, but also to many decision-making mistakes in terms of content and timing. In Spain, recentralization was perhaps even more radical than in Italy, but equally it met resistance and did not reduce, but in some cases, I think, exacerbated competitive territorial dynamics. When it became clear that the situation was deteriorating and territorial coordination was hampered by vertical fragmentation of powers, the central government in Spain emerged as a focal point in crisis management. The socialist Prime Minister Pedro Sánchez announced the declaration of the state of alarm on the 13th of March. This was a constitutional measure proposed by the executive requiring only the approval by absolute majority of the Spanish lower chamber, and involves the total centralization of all lockdown measures in the hands of few ministries. These measures were not previously negotiated with the regional governments, at least in detail, but instead were unilaterally imposed, thus undermining the regional competence on health matters. However, this strengthening of central authority vis-a-vis regional, it's apparent strengthening of regional authority vis-a-vis regional of central authorities vis-a-vis regional authorities was quite fragile and precarious. First of all, Sanchez's government lacked a majority and had to rely on difficult cooperation with the opposition, which also included regionalist and pro-independence parties. Regions could also continue to take measures as far as they did not collide directly with central decisions. In fact, there was still some regional diversity in approaches and regulations. Regions continued to clash with central government over the allocation of competencies and the nature of lockdown, with Catalonia, for example, demanding tougher measures and calling for the regions to be closed off from the rest of Spain. Clearly, pre-crisis factors which predated COVID-19 affected the way the pandemic developed in the two countries. When the virus started spreading, Spanish politics found itself in a worrying spiral of polarization and fragmentation, both ideologically and territorially, due to the rise of strong secessionist tensions in Catalonia, but also in other territories. Thus, attempts at centralization by the Spanish government were confronted with dynamics of territorial competition based on conflictual interactions between Spanish state on the one hand and regions on the other. In Italy, regional politics was less confrontational than in Spain, but still quite fragmented and subject to centrifugal dynamics. This also seems to have led to extreme territorial divergence in the final outcome of the first wave. So in Italy, almost half of the total deaths were concentrated in one region, Lombardy. Of course, demographic and socioeconomic factors may have also contributed to this. Yet regional governments still clearly played a role in determining the evolution of the pandemic. This is well exemplified by the diverging paths followed by Lombardy and its neighboring region, Veneto. Despite the fact that first cases appeared almost simultaneously in both contexts, in May, Lombardy had 155 COVID-related deaths per 100,000 inhabitants, while Veneto only had 37 per 100,000 inhabitants, below the national average of 53. Observers have pointed to the different health systems existing in Lombardy and Veneto, and they've shown that different emergency measures were adopted by the leaders of the two regions, despite belonging to the same party and being subject to the same national lockdown. In sum, in a context of weak centralization and absence of coordination mechanisms favoring diffusion of good practices, COVID-19 ended up reinforcing pre-existing territorial fragmentation. In conclusion, what are the key lessons, in my view, that we can learn from these two cases? Decentralization per se is not a better option than centralization. Decentralization in a context of high political fragmentation, lack of coordination mechanisms, and absence of consensus-based politics may actually exacerbate competitive pressures and territorial inequality. I think this finding is also relevant for the debate in the UK, and particularly in England, but also outside England, in the relations between England, Scotland, Northern Ireland, and Wales. But particularly in England, given the current debates on territorial governance arrangements, it is not sufficient to devolve power to lower levels of government, but it is also important to consider how these powers will be used by national authorities and regional authorities, and how different territorial levels will interact with each other, and what type of territorial policy dynamics will emerge in the face of an emergency. Thank you.
Thank you so much, David. I really, really appreciate that comprehensive overview of where we are today. If I can hand over to Juan Luis, who will give us the picture from Spain. Thank you very much.
Thank you, and thank you, David, for a very good summarization of our political framework as well. First of all, and besides giving the thanks to the team for inviting me, I have to apologize in advance, just in case a couple of little kids run around me during the event. I'm sure that's something we all are much more used to nowadays, right? Okay, so after David's intervention, I think I'm going to summarize a little bit my points, because the summarization has been done, and I can give a little bit a couple of insights more related to national politics or national perspectives, and how ideology and political culture is also shaped this debate, because I don't think it's just a debate about the political framework or centralization versus decentralization. There's a lot more in play here. And I probably need to start by saying that we journalists, not very analytical people, even when we try, have been trying to analyze lessons from Asia, lessons from Italy, as a time machine, right? The pandemic started far from us, and when it impacted us in Spain, we tried to understand it by reading what other journalists have been writing in those countries. I'm afraid that we didn't understand much. I'm afraid that the lessons are not clear even today. I can say that we in Spain, at least, have a clear idea on why Madrid is the epicenter of the thing worldwide for a few months, and then declines, and then Italy is much worse, and then France is much worse than us today. But 1 month ago, the measures on place seemed crazy, and now they seem in Madrid that are working, but we are really hesitating about how clear and rigorous are the data we are looking at. So we really are in the middle of a huge confusion in Spain about not the official data. It's not that we don't trust the data. Of course, people don't trust the data, but it is not about how trustworthy the data is. It is about how that metrics is helping us to understand how the virus is performing. From the very beginning in Spain, beyond at the very beginning in Spain, beyond the discussion about centralization and decentralization, we had also a tension between we can't not close the country because economic is devastating the whole society, versus we need to close the country, otherwise devastation is going to be worse, even worse in the future. That is not only that is not exclusive from Spain, but I think that is central to the political debate, because different regions in Spain have been pointing out different measures, completely different measures, even being from the very same political party in that X of coordinates. At the very beginning, the first wave of the pandemic in Spain was basically, the debate was basically about, did the government act too late? It was not about did the government did too much. It was a part of the society that said, okay, we are getting rid of our freedom of movement. There was a tiny part of society that kind of said that, but at the beginning it was, you acted too late. And centralization was not, according to the polls, according to the political mood, was on the media debate, but was not something that really worried the citizens, according to the official poll. So during the first wave, you have a government that acted too late. Then when the government reacted and put into the field one of the most tough, one of the tougher lockdowns in Europe, then the curve started to decline. We really approached zero. And then the people believing that the economy needed to be restored started pushing to reopen the country. Some of us, I am biased like everyone else, some of us think too soon. And but today I can't say that I'm right, because again, it is so confusing. But what we did see is that right after opening the country to tourists that never came, to the investors that never came, and when we were out of the streets again, doing the new normal life, and that was the beginning of the second wave. And in this second wave, it is a huge conflict between decentralization and centralization. And you have this very bad praxis, political praxis, which is the regional government say exactly the opposite thing of the central government, no matter what that thing is. In 10 days, if the government kind of changes position, then the regional government changes again, just in order to be again of the central government position, because this has been the political debate, not only the management debate or the ideological political debate of the year. And the only way of having a political profile right now is controversy on this issue. And the lessons also that are on the political debate in Spain are also about what we did about public health system in the past few decades. What about the public hospitals that were sold to private management? We have now a series of controversy about hospitals that are not being fully used, while public hospitals are completely overwhelmed, right? And all that baggage of different backgrounds, political backgrounds, are there. I wouldn't say it is just about who needs to run the measures, who needs to push the agenda. It is more about the ideological framework that the different levels of governments have been choosing to pick. And again, you have the central government of Madrid doing this, and then you have the Andalusian government doing the exactly opposite, being the same party. Just because the polls are saying, okay, keep fighting, or let's relax, in a very wide simplification, if you allow me. So right now we are seeing how for instance, the tests that are doing in Madrid changed. We stopped doing PCR, and for the most cases, myself this week, we are taking antigen tests, and that's making the stats to decline a lot in terms of positiveness. Are antigen tests trustworthy? Yes, apparently for certain cases, not for the whole population. And then again, we don't see how data is helping us right now in this second wave to understand if we are going up or going down. So basically, people are finger crossed waiting for the vaccine, the 95 or the 95.6 or the 97 average of success vaccine, whatever it comes. But nowadays, I would say that the regional and central governments are waiting to see if vaccines are accelerating really, because they were playing the chicken game with something very dangerous, that was open the bars, close the bars. Tourism, yes, but not the people in the bars. Then tourists, where they are supposed to go to the beaches, but the beaches are closed only for tourists. What? So all that puzzle, I completely agree with David, is impossible to understand. I mean, the picture you have about the measures in Spain is not at all something you can understand if you land to Earth today, because it's an aggregation of contradictions. Most of them have been put in play just in order to attack or counterattack from a government or regional government perspective. I think that the most belligerent government in this, the most abusive government in this aggressive play is being the regional government of Madrid. Not all governments by the same party, Conservative Party, have doing the same. So it is not about the party is good, party is bad. It is this regional government chose to do that. And of course, national government has made their mistakes, but they're trying to calm things a little bit out of try not to lose control, basically. That at some point really was about to happen. So that was my little insights.
Thank you so much for that insight. We're now delighted to bring in Alberto, and I think, yeah, obviously we've heard from both Davide and Juan Luis the sort of challenges of regionalism, and I think, and how all different layers of government are responding to this in real time, learning on the job, and exposing some of the tensions between different tiers of government. We'd be delighted to get your viewpoint as chair of the Italy APPG, but also just looking at how different countries are responding in different ways. And obviously, I know here in the UK, you know, some of the previously hidden, perhaps sometimes hidden tensions in the devolution settlement have been shown by some of the different approaches to lockdown. But really interested in getting your thoughts, Alberto. Thank you for joining us.
Well, thank you, Adam. Good afternoon to you, and good afternoon to fellow panelists and participants that are watching and listening to these proceedings. I listened very carefully to David and Juan Luis's very detailed overviews of their own understanding of the experiences of Spain and Italy. I don't profess to have any expertise whatsoever when it comes to Spain or Italy, and the comments I'll make are based really on anecdotal evidence that I've gleaned from professionals out in Italy, peers, and family and friends who live in Italy. As you can probably tell from my name, if not my accent, for sure not. I am of Italian extraction. My parents came to the United Kingdom in the mid-1960s. So I have extensive family across Italy, mainly in Sicily, but interestingly, for the purposes of this discussion, I have some close relatives that live near Bergamo, which was the epicenter of the challenges and difficulties that Italy experienced during the first lockdown. Now, the question that you ask is, what lessons can we learn from the responses to COVID-19 in the two largest nations of Southern Europe? I think there are 2 points to consider in order to understand the lessons. The first thing is perhaps to do a comparison between, in the case of what I'm about to say, between Italy and the United Kingdom, and look at our different political and legal systems and what impact those legal and political systems have had in the way that we manage COVID-19. And secondly, in answering that question, what's most important now is how we go forward. The very good news is that there is a vaccine or two on the horizon. We're all waiting with great anticipation for that vaccine to finalise in its stages of development and eventually be rolled out. But we're all realistic. Before any of us are vaccinated, it will be many months down the line. And I think it would be realistic to say that, having looked at what's happened to Italy, Spain and Britain over the last 8 or 9 months, that the logistics in manufacturing, assuming that you purchased the vaccine, manufacturing the vaccine, in obtaining the vaccine, and in distributing that vaccine is going to be an enormous logistical challenge, such that we've not really witnessed in peacetime ever. There is no comparator to this. We can't say it's the biggest distribution since wartime. I don't think in the Second World War they even had such a logistical challenge of getting a vaccine to all members of populations of their country. So we're facing truly unparalleled conditions, and no country has got experience of this. So we are learning as we go along. Now, what I would say is, David made some comments that even within Italy, the differences were pretty noticeable during the first lockdown. And he said that Sicily had been minimally affected. And from my own anecdotal evidence of, my parents are from Sicily, Sicilian extraction. So as I say, I've got many family and friends there. Indeed, that was the experience that my family had, that in many villages and towns across the island of Sicily, there were virtually no instances of COVID. And I ask why that was the case. Now, I'm sure all of us can come up with various views. In the Lombardy, in the North Italian area, which is the economic and industrial strength of the Republic of Italy, there is clearly more movement between people. There's more social mobility intra-Italy, intra-Europe, and indeed globally. And so it's perhaps unsurprising that COVID manifested itself in areas where people were coming from different parts of the world. Sicily has a less mobile workforce. There's less social mobility in Sicily, and there's less movement even between towns in Sicily. If you go to Sicily and you go and use their motorways, you very rarely find the motorway network busy in Sicily, because there is a lack of movement of people and goods. People tend to be very much based in their villages or their towns. And therefore, when it comes to the experience that they've had from COVID, purely on economic grounds and on social mobility grounds, there was less opportunity for this vicious disease to spread in areas of Sicily. But does that give us a lesson that we can use in other countries? I don't think it does. So what next? What other reason did Sicily see less movement or less spreading of the virus than we saw elsewhere in Italy? I think another reason is that the legal system and the political environment in countries like Italy, and particularly in southern parts of Italy, is more susceptible to regimes where authority is easier to impose. Now, what do I mean by that rather inelegant phrase? I think I can contrast it easily with the United Kingdom. In the UK, we have a society that is policed by consent. And as a lawmaker, at the forefront of my mind when I passed these laws with my colleagues in the House of Commons, draconian laws impacting on all our freedoms, I was mindful that laws are fine to pass in the House of Commons and to legislate, but the real key is, are they enforceable? And as I say, policing is by consent in this country. And I must confess, I didn't expect to see such a high percentage of British residents following the regulations so strictly. I would have expected around up to 70% of the British population observing the regulations during the first lockdown. But in fact, I was surprised, as were many of my colleagues, that a higher percentage than that strictly followed lockdown regulations. And that, of course, was very welcome. And yet, when you look at countries like Italy, countries that have an obligation incumbent on every citizen to carry an ID card around, which we don't have here in the United Kingdom, the experience that some of my family and friends had included the obligation to download a form from the internet on every occasion that the citizen wanted to leave their home, even for essential food shopping. And if they didn't have the form, albeit that it was a self-certified form, if they didn't complete this form, download it and have it on their person as they went about their essential daily business with permitted actions such as shopping for food, they could be fined on the spot by the police. Now, we didn't have that situation here in the United Kingdom, and that's not a law that I passed. That would have been, in my opinion, given that we police by consent, it would have been a step too far in the United Kingdom. So I think that's certainly one of the primary lessons to learn, that the political and legal systems of the countries in question, in this case the UK and Italy, are different when it comes to policing, and that may have had an impact in how you manage to ensure that the population fulfills its regulatory obligations. And as I say, in Sicily, again through anecdotal evidence, and I hasten to add that this is anecdotal, but I heard from a number of credible family and friendly sources that local authority, elected individuals were going around with megaphones instructing people not to come out of their houses in villages and towns in Sicily. Now, that's just not something that we would expect to witness here in the United Kingdom, and we didn't. And so I think that, with the other reasons that I've cited, maybe why Sicily didn't experience such a spread of the epidemic as we saw in other parts of Italy, Spain, and indeed the United Kingdom. Interestingly, however, Sicily, like Spain and the United Kingdom, during the course of the summer and early autumn, younger people, and by younger I mean under the age of 30, encouraged to go out again. And in the UK, we have had the go out, to eat out, the helping scheme for restaurants, for example, Eat Out to Help Out, as it was named. We were encouraging people to return to some normality in our economy, and Italy did the same. And we saw, and we've witnessed, and we're currently experiencing the so-called second wave, where we've seen an increase predominantly among the younger population who have been infected by this virus, but most of whom are asymptomatic and are simply spreading it to others. So how do we deal with, what lessons can we learn therefore in going forward in tackling this second wave and further to that? I think given that we've got these two vaccines that are potentially going to be the game changer in this, the question is how quickly can we get them distributed? And I think regulation is important here because we will, I say we, UK legislators, Italian legislators, Spanish legislators will have to take into account what is the best mechanism through the legal system to ensure maximum efficiency in logistical distribution. So again, in the United Kingdom, it is unusual to require the services of the military when it comes to civilian issues. And again, that goes back to the point that we police by consent. But the military are being asked to assist in this matter, and the military will be assisting in this matter when it comes to the mass distribution of a vaccine for our citizens. And therefore, I need to consider with my colleagues what legislation we will need to pass, what regulations we will need to approve specifically that will allow this distribution to take place as efficiently, as quickly, and as effectively as possible. And it may well be that we will have a system where we will prioritize, and we will have to strictly enforce that prioritization. And therefore, there will have to be regulations that will ensure that people don't take the vaccine if they're not within that priority list. And we will need to ensure that there is an enforcement mechanism that mitigates against the risk of people taking the vaccine when they're not in that priority. So these are considerations that we need to take into account in terms of how we distribute the vaccine going forward. So certainly lessons to be learnt in how Italy and Spain and the UK have dealt with the first wave of COVID-19. But we are going through, as I said at the outset, an unprecedented situation. And we all need to do our very best as policymakers, as academics, and as interested stakeholders to have patience in understanding that we live in free societies, Italy, Spain, and UK, all free societies. And in free societies, we must maintain as best we can our freedoms whilst maximising the efficiency of undertaking this enormously complex logistical task. I think that's probably it. I'm happy to answer some questions if there are any.
Thank you.
I will need to leave by about 5:30, but I'm mindful that you've got other panelists as well, Adam, to speak to.
That's lovely. Thank you very much, Alberto. So yeah, as Alberto said, please, we encourage you to ask your questions in the Q&A box, and then we'll pick them up at the end of the panel. You raised some really important points, Alberto, about the the potential differences in political cultures that may inform certain responses. I think there's also what other people have said is there are also differences in the ways that the states are structured between the UK and Italy and Spain. I think, frankly, you know, the way our policing is structured at the moment is quite response-led, which would make it quite difficult for them to do the sort of individual person-by-person form checking that those other police forces have been able to do. And similarly, obviously, the debate in the UK has primarily been about the national versus local in terms of contact tracing and everything else. And I think, you know, the pressure here has been to encourage to go more locally than perhaps the government has, and obviously, but in other countries, examples that you've just given, there have been examples of that regionalism and differences is creating problems. So it'd be interesting to get into that trade-off in the Q&A session. But I'll hand over to Peter now for your thoughts.
Okay, now you can hear me. Thanks. I just want to cover 5 points, and I wanted to share a slide for the last point, if that's possible, Adam. I think I can. It says so. Anyway, so the first thing is the lessons that we have. I live in London, but I'm currently in Dublin, where I've been for the last 6 months since June. I came here for a week. I work in Dublin where our office is, but I live in London. But I have stopped my commuting between the two cities. And I'm just going to pick up 5 points that from an international organization that we've noted, and Makeda will build on it. The first is the speed of learning that has happened around the world in learning from different societies. And one of the things that didn't happen with Italy was that we in the UK and those in the US and Canada did not learn very quickly from the Italian experience, which was happening in February. We didn't even learn from the Chinese experience that well. We acted quite slowly on that. So the need to have the speed of learning is a real big thing that's going forward. The second thing that has happened, and I think that it has been alluded to before, is that what COVID has done is revealed the inequity in society as who actually gets affected by COVID, whether it's a rural or poor area, or whether it is Black and Asian minorities in the UK, in American, African Americans or Latinos, or Native Americans. Those are the people who got really affected for many different reasons. And that is what this has really revealed. And we could have learned that from one society to another as we're going forward. And I think that that kind of learning was I'm talking about the speed of learning. We did not learn from other societies what was going on and could predict within our own societies ahead of time that these would happen. So for example, problems in care homes were happening in Italy before they happened in the UK or in Scotland or on Ireland, Northern Ireland. They happened before they happened in Canada. There was a major problem with care homes in Canada, but they could have seen that that was going to be a problem because there was a problem in Italy a few weeks beforehand. So I think that one of the things that we need to look at really now between the different countries in Europe is how we can make the speed of learning from what's going on in different societies and say that this is what might happen here. And I think that is very important. The issue about the equity and how we can ensure that we are protecting those who are most vulnerable. We're not talking about the most vulnerable. There's also another whole area that we have been transfixed by or forgotten is those who haven't got COVID but got other conditions. And now because the hospitals have been focusing on COVID, they have now been affected adversely. And so some people call these the collateral damage or the unaccounted for deaths rates above the norm. But we really haven't worked out how to deal with this because of the concentration. And I can see that this is something, again, that different societies could learn at how do we manage to run the normal healthcare service for their populations, as well as the emergency service for those who have COVID. And again, this is one that different countries have different solutions, but this is, I think, the real opportunity for us to learn from each other on how to do it. And the last one is that I really wanted to concentrate on is the use of data. And this is where I'm going to share it because both Davide and Juan Luis spoke about data and the lack of data which can predict. And so we at ISCRA have been working with some people in, I'm sure you can you see this now? So the idea is, can you predict the future with using data that, and this is from Rocco Perla, Gareth Parry, Kevin Litton, Shannon Provost, and Lloyd Provost. And it's basically, we published this data, the early papers, and we've just put on our website using Shewhart charts on reported deaths to see whether you can predict what's happened. So someone like Alberto sitting in Parliament wants to know, what should we do? And really what we're normally looking at is data in retrospect, looking data backwards and saying, this is what happened. Can we predict what's going forward? And I think this is where we can really learn a difference. So this is just their methodology on how to look using COVID deaths and getting the data in, and then really not modeling or simulating, but using empirically based data to predict what's going to happen. So here's just the key line is look for the red dot which is a signal of a special cause. Something is about to happen in which you can predict that's going on. So let's look at this. This is the model. You have the growth, the pre-growth, the growth, you can see the growth, the post-growth, and then the stability. And we're going to ask, where are all your countries? So I'm going to show you your countries right now. This is the United Kingdom. And so here you can see, this is from March, you can see the growth, the pre-growth, the post-growth, period of stability. But there you see these red dots. And those red dots indicate something is happening. In fact, on this red dot in September, the death rate was very low, and people were saying, oh, the death rate's very low, it looks good. But something was happening because it was a special cause that day. And that was the first sign of trouble. The first sign of trouble was in September, predicting what will happen. The second time of trouble there was in October, but the lockdown was only done 44 days between the first signal and the last one. And I think using these charts would help politicians and policymakers to have better data than the stuff that we see provided right now going forward. So let's look at what's happening in Germany, for example. There's the first sign of trouble in October the 1st, and that's when they did the partial lockdown 30 days after the first sign of trouble, in which the statisticians can predict something is going to happen going forward. You can look at France. Here's France, the first time of trouble in September, second time October, and the national lockdown 52 days later from the first time. And I have now, I've just pulled this off our website this morning, or this to show you where Italy is, because we're talking about Italy. And there you can see Italy has gone, they had a very quiescent phase, but lots of signs that something was going to happen. Something was going to happen. There you can see I put the arrows, and now they're in the epic growth phase. So they can do, they're going in the wrong direction, definitely at the moment in Italy. And if I look at Spain, there's Spain, you can see it's an early growth phase. They're in epic growth of reported deaths, so they're predicting it's going to go up. And there you can see on the 4th of September was the first sign of trouble. So if one was asking how to predict going forward, well, these kind of use of data in a predictive way can help you make decisions. And it's really trying to look at variation and study variation, not respond to every day. So when people say the daily average and so on, they're not using data correctly. And I just put Portugal as well, because it's next door to Spain, and they're also in a growth phase right now in phase 2. And you can see they're going to grow up till they turn the corner, and what you can do every day. So on our website, these are updated on a daily basis. And you can go in and you can look at, and actually when you go on the website and you click on the dot, you see the actual number of deaths in the that day, the upper and lower control limits, and the prediction that's going to happen. Now, the reason I share this is that I think it's very important for us as we plan going forward, is to be able to predict what's going to happen in terms of incidence and prevalence. My view on the vaccine is that it's not the solution. It is one of the solutions. There are lots of things we have to do in order to have it successful. And I think Alberto was very, very right, is how are we going to get it out to everyone in the population? But in the UK, how are we going to get it out to people who do not want vaccination, who do need it, because it's a very big anti-vax movement. I'm a pediatrician, and I know that there are many, many parents who refuse to have their children vaccinated. And so that's going to be a big challenge for the politicians in all the countries to ensure that the people who should get it do get it, not only those who don't need it get it. So I think that's even the bigger challenge that we're going to face. And every society will be a little different, because we do allow children not to be vaccinated in the United Kingdom at our cost. And we had measles epidemics, for example, for that reason. So that's my points. Just to summarize, we need to learn how to learn faster from each other. We need to use data for prediction. We need to think about how we can learn about protecting the vulnerable and predict who's going to be the next set of vulnerable people. And then the last one, we need to think about the collateral damage. And then finally, the last one, which not least, is we need to really think about our interventions and how we looked after people who providing care and people receiving care in terms of person-centered care, because that seemed to go out the window when we were thinking about how to protect people and keep them very safe, but their mental well-being was not looked after very well. Thanks very much.
Thank you so much for that, Peter. We'll hand over to, we'll just remind people, please do put your questions in the Q&A box for us to pick up at after Mihaela has finished speaking. And if Alberto does end up having to go shortly, thank you very much for your contributions today. Just hand over to Mihaela to round off our initial discussion. You're currently muted.
Hello to everyone, and thank you very much for the kind invitation to such an exciting and challenging debate. I am a physician. I am a specialist in internal medicine. Actually, I'm working as a clinical risk manager in an Italian public trust, and I'm also a member of an Italian association, a scientific association for patient safety, Italian Network for Safety in Healthcare. For these roles, since the beginning of the pandemic, I has worked as a sort of a collector of what has worked and what has not worked in the organization where I work, in my country, and with a look also at the other countries. In fact, we released as with the International Society for Quality in Healthcare, HISQA, the Patient Safety Recommendation for COVID-19, a collection of lessons learned useful to ensure patient safety also during the pandemic. I agree with the background, with the criticalities you highlighted in the background of today's event. I would only add that the regional differences of mortality, if we look at the first wave in Italy, mainly were due to the early lockdown for southern regions. Because when on the 9th of March, our government decided lockdown, the infection were not already spread to southern Italy. And in fact, there are differences of mortality, but also differences in terms of prevalence. At the end of the phase 1 of the emergency, on the 18th of May, we can count many thousands of affected in Lombardy and just a few hundred of affected in some southern regions. So the pre-existing differences due to the different regional governments, the regional governments of health system, maybe will be more evident in the second wave, as now we have an infection more diffuse in the population all over the country. In addition, our health ministry did any effort with the support, the technical support of the Istituto Superiore di Sanità and operational support of the civil protection to standardize management procedures and also to provide the resources according to the needs of the different regions, even within the limits of the differences created by the regional governments. But the main reason of the mortality difference is the prevalence of the infection for the first wave. In the response, the difference in terms of response, of health response, are based also on the different regional healthcare governments. What has worked in Italy during the first wave? We could appreciate an extraordinary resilience of healthcare workers, their flexibility, self-denial, and adaptability to critical situation. They have often anticipated anticipated the right solution. They arrived before the management many times. We also could appreciate the solidarity between regions. Many physicians from less affected regions have been moving to more affected regions, and also the availability to share within the country experience and lessons. That's the case of our COVID-19 patient safety recommendation. That's the case of the national databases, national database of good practices established by the Italian Health Ministry, and with a section specifically for the COVID-19. And that's the case also of a less formal Facebook group only for physicians that started at the beginning of the pandemic, and it includes nowadays over 90,000 Italian physicians that every day share their knowledge and their experience about COVID-19. What has not worked instead in our country? Well, Italy was the first affected country in Europe, and it was affected when the situational awareness was very low in Italy and also in the surrounding countries, and long, we can say, peaceful times had made all of us lose the memory of pandemics. And indeed, an international survey we did, promoted by ISQA, and we participated in, showed that only the countries recently affected by SARS-1 and MERS pandemic were more prepared to the first wave. The difficulties we had to deal with in Italy derived mainly from changes and reforms not made in the last decades, such as the expected reorganization of primary care, the expected reorganization of hospital care that is still specialty-based and not very useful for polypathological patients that are the mainly users, hospital users. I'm speaking also about the implementation of telemedicine in Italy, and the implementation of more digitalization, more information technology in healthcare in Italy, and also some reforms to prevent and reduce the healthcare workforce shortage and healthcare overload due to chronic disease. And I think these problems are common also to other countries in the world. What proved to work according to our experience? Against COVID-19, I think that the password is anticipation rather than control. So the lesson learned, we learned that the approach to the problem, to this emergency, must be systemic and not sequential. In Italy, in the first wave, first we dealt with the problem of swabs, then with the intense UTI, then in a sequential way. Instead, the approach must be systemic. There is not a single, not one intervention that fixes everything, but multiple simultaneous interventions are needed against COVID-19. Further, restrictive social measures need to be applied early. Just when you think they are excessive, exaggerated, that's the moment you need to apply more restrictive social measures. Because if you realize selective and early lockdowns, you can help to save economy. aggressive contact tracing and intensive testing are crucial, and also structured home management of COVID-19 patients can prevent hospital overcrowding and its consequences. In Italy, for example, we have some difference in mortality in the different regions can be attributed to a better or less organized primary care. And also we learned that healthcare staff is a big value to protect, and universal coverage is important. Care must be multidisciplinary and integrated. Knowledge and experience must be shared very fast, and information and technology and effective communication are key component, essential components of modern healthcare. That's our contribution from Italy. Thank you.
Thank you so much. That's, I mean, we've covered an enormous range of things and great detail from some wonderful experts. Thank you so much from that. Again, to encourage people to put questions in the Q&A or in the chat. I think there's a couple of things from my perspective. Obviously, it'd be interested if the panelists have particular questions they want to ask each other. Really, I think there's a lot of different regional perspectives here. Again, I come back to this way looking at the lessons that we can learn here in the UK from the responses. And I think, to me, again, if you're looking at the debate here, it is the rightly or wrongly, the government has focused on doing national level response, of which local government has been an implementing body. This is certainly within England. I mean, obviously there is a separate dimension about the different responses in Wales, Northern Ireland, and Scotland, but that local authorities have been sort of helping to deliver things, but they've not. There has been limited flexibility in what different local bodies could do. I mean, I think there's obviously some innovation to council level, but the framework is being very much set at the top, and the criticism here has been that more needs to be done locally. From what we've heard here at the beginning, in particular, was that there was some confusion for local people caused by different local authorities doing different things. And I'm trying to sort of tease out, what are the challenges in the Spanish examples that Juan Luis gave or whatever gave. Were there examples of things that could have been done differently to overcome some of those informational problems that you had, because lots of different local bodies were doing things differently? It's again, just to be interesting. Juan Luis, do you want to come in on that at all?
I think that the most obvious example of that is the openness to tourism by the beginning of July. Actually, you as United Kingdom was guest in that show, because you canceled all the flux of tourism in order to avoid that British people spending a few days in Spain would come back without quarantine and that stuff. You have a country that says we are opening to tourism, and then regional government saying we are not opening schools. And that sends a mixture of feelings very difficult to understand. So what I think that the central government did well at the first wave was having 3-4 very clear, very simple rules, and not trying to adjust every rule to the different nuances of the political debate. Because at the moment that you start saying, okay, this is not exactly this, to not annoy this regional government, and not exactly this, not in order to avoid to annoy this commercial group or this professional public branch, or you start to do so many exceptions, even 3 exceptions too much to a rule that people need to understand right away. So to be clear in the rules needs to be short, clear, and tough. And then you can kind of open or close the strictness of that rule by the law enforcement. But the rule needs to be very clear. So the first wave was, I mean, Spain was an example of sacrifice. I mean, the streets were completely empty. I know there were some beaches in Mallorca and in Canary Island where someone did a picture of people in the, okay, 3 examples of very mediatic things, but the 99% of the country was empty during months. So we did it because we believed that we needed to do it. Okay. But during the summer, a lot of mixing messages were given by the governments, regional governments and national governments, and that was the thing that made everything to ruin. Because young people said, okay, so my little brother needs to go to school, but I can't go with my friends to have a beer, or the other way around. I can go with my friends to have a beer, and my parents need to go to work, but my little brother can't go to the public park. So and every region has a different rule, and there is no public level of prevalence of the virus to start a new package of rules. I would say that's another thing that central government did wrong. There were no public transparent parameters to say, okay, you are over 100. So over 100, you don't go to parks, for instance.
Yeah,
that's something they didn't want to do.
That's what the government tried to do before the second lockdown, was to set national limits that then triggered particular local tier lockdown.
Now in the second wave, after actually the central government in the second wave, in a while was waiting the regional governments to pray for help. So actually the central government kind of let the regional governments have the problem. So they guarantee somehow the regional government is not going to use your measures if you took it too soon. So it's like, it's your problem.
Yeah.
You are regional governments. You are ruling the thing. And if you need help, just call me. They didn't call. So at some point, or not everyone called. So at some point, central government again said, okay, I'm coming to the central focus of the management to start doing things differently.
Yeah.
And the tension is still going on.
Brilliant, thanks. Hugh Grant has requested that Alberto give his perspective, if that's possible, on the sort of central and regional responses from a UK perspective, including sort of any English regional responses. That's from Hugh Grant in the I don't know whether that one or not, but in the Q&A. Alberto, is that something you want to come in on?
No, sure. I'll just give this answer, if you don't mind.
Of course. No, thank you so much for giving us all of your time.
Not at all. So firstly, to Hugh's point about the difference between central versus regional. Of course, the United Kingdom has 4 nations in our sovereign country. And within those 4 nations, there are 3 legal systems. And within each of these countries, there are different tiers of government. So in England, we have a nation that has within it its own devolution. So we've got devolution, for example, in London. And we've got in some areas like my constituency of South Leicestershire, a 2-tier local authority system. So the complexities of the governance structures in our United Kingdom actually help to answer why we get some of the issues that Juan Luis has just asked, because I was part of it. I was at the very coalface when these decisions were being made and when questions were being asked of me as the MP. Why has this been interpreted in this way? Why is it that if you live in that street, you're okay, but you cross the road and you're within a lockdown area? It was compounded with the fact that part of my constituency was the first in the United Kingdom to experience the first lockdown, the first local lockdown back in July. And what I can say is that behind the scenes, what you have is the machinery of government, which is made up of many different departments, each with its own stake. You've got the health department, you've got housing and local government, you've got the treasury, you've got cabinet office, and those departments have got to communicate with one another when these regulations are made. They communicate with stakeholders, including MPs, and then MPs and other stakeholders communicate with the local stakeholders, such as county councils, district councils, Public Health England, university hospital trusts, and the like. And inevitably, in a fast developing, fluid situation, in an area that's unprecedented, you're going to get mistakes. You're going to get communications messed up. You're going to get a lack of clarity on where the regulations apply. And this is inevitable. You're dealing with human institutions. And I think broadly, people understand the complexities of the situation that decision makers are facing. So when my constituency went into local lockdown back in July, or at least part of it, the map, the boundary for where those local lockdown regulations applied had not yet been finalised. When in the House of Commons, my colleague made the announcement that the local lockdown would take effect midnight at that point. And the reason was it was very fast moving and fluid. So in the morning, I was trying to liaise with the local stakeholders whose duty it was to delineate which area was in the local lockdown and which area was not. And I had parts of my constituency where streets were cut in half. And naturally, constituents were asking me, are we within the local lockdown area or not? So these problems are inherent with human institutions, particularly when you're dealing with a very fast-moving, fluid situation, which is unprecedented. Now, that's not an excuse. It is simply the reality of the situation. And if you accept that reality and you accept that people are trying genuinely their best to get in place a situation that ultimately protects all our health and minimizes the spread of a deadly virus, and most importantly, minimizes anyone dying from this virus, then you'll accept that there is that challenge that any form of governance, whether it's in Spain, Italy, or the UK, whether it's at local or national level, whether it's non-governmental agencies involved, whether it's devolved government or not, will face. But the second point, really in answer to Hugh's question, is that Britain has these different structures, and we have to therefore accept that Scotland, Wales, and Northern Ireland will make their own political decisions based on the evidence as presented to their decision makers. And it's therefore not surprising that you will get a different result. So my message actually to constituents, to all of us affected by this, is that expect an element of complexity to this. The most important thing ultimately is that the messaging given out by the devolved governments, by the national government, by local authorities, ultimately is broadly the same, which is basic hygiene, wash your hands repeatedly, keep distance from other people, and wear a face covering. And that message, as I say, is the same, not just in the UK, Spain, and Italy, but elsewhere that's experiencing this, this lockdown. My final point, and I do need to go, Adam, my final point is this, that even with this current lockdown, I've got businesses coming to me on a daily basis saying, are we allowed to open or are we not allowed to open? Because the classifications cannot be exhaustive. There are so many factors that play in our societies, so many different types of businesses, so many different types of charities, so many different types of human activities, that it is almost impossible in a free society to legislate at pace and to regulate and define absolutely crystal clear every sort of activity prescriptively of what you can and cannot do. And this is where I'm afraid there has to be an element of common sense. So whilst Juan Luis's comments about kids are able to play in one area, but they're not able to do that, That is simply as a result of the challenge of trying to adopt common sense rather than prescriptiveness, because with prescriptive regulations, you can open essential businesses. What are essential businesses? Food. What about if a business sells mainly mobile phones, but a bit of food on the side? Are they regarded as essential businesses? We saw this with, for example, the Range. When in the first lockdown, the Range was accused of not really being an essential business, but able to circumvent the regulations. And so there is no surprise. So my message is, I'm afraid we have to adopt common sense and understand that we are dealing, no matter which colour of government you have in office, we are dealing with an unprecedented, challenging situation. Adam, with that, I'm going to have to leave. It's been a pleasure taking part, and thank you also to the panelists for their very interesting contributions. I wish you well for the remainder of the evening. Thank you.
Thank you so much. Really appreciate it. Take care. Does anyone else want to come in on that on that point? I mean, maybe an Italian perspective from Davide.
Yeah, I want to say something about from the Italian perspective, what Michaela said earlier, but also from a Spanish perspective, was one Luis said earlier, that of course now the divisions at the subnational level are emerging, are more visible in the second wave than in the first wave. But in my view, they were already there in the first wave, particularly in the first days of the pandemic. And this is something that, I mean, in Italy, for example, there was a lot of uncertainty about whether schools should close, who was responsible for what. And it's true, earlier we did this comparison between Sicily and the north. And of course, that's not so much about regional politics. And Antonio explained that there are some demographic reasons that explain this variation. But I think, in my view, that the structure of government, and here we go back to the decentralization issue, the structure of government also affected the outcome in the first wave, because in northern Italy, we have Lombardy, but we have also Veneto, which is the neighboring region, which had a very different outcome. And this, for many observers, was also due to how different regional governments dealt with the pandemic. There is the issue of care homes, for example. So decentralization, I think, already had a big impact in the first wave. And there are a lot of problems, not just of communication that Antonio was underlying, that you need a coordinated message, but in a decentralized system, it's also a matter of what policies each regional government puts in place, even within a framework of national lockdown. And also, it's very difficult for the central government to monitor closely what's happening in all the regions when you have such a decentralized structure, particularly in the healthcare sector, which is the case of Italy and Spain. So I think these are lessons that we can learn also in the case of the UK, because there are a lot of debates about whether to decentralize, centralize, and so on. That's what I wanted to say.
I see both Peter and Mihaela want to come in. Can I ask, perhaps potentially when you do come in, if you might also be able to address Frank Stevens' point about regional coordination, and he asks, you know, was the corporation eased by spare capacity in Germany's regionalised health system, allowing a speedy response? Basically, how does that, is the ability to sort of move resource and capacity around a factor that was the case in any of the other countries? But shall I go to who wants to go first, Peter or Mihaela?
Mihaela can go first.
Mihaela, do you want to go first?
Sorry, no, I agree with David about the regional governments made the difference in health response. What my observation was about the mortality. The difference in mortality, I think, will be evident the burden of the different regional government in the second wave. About the health response, that's true. I would like to share with you, before we go, just a nice study, if I'm able. Wait just a minute. Okay. A nice study we tried to do in Italy. We tried to, can you see my screen? Yeah.
We can.
We tried to make a combined assessment of the health and economic impact of lockdown measures in the different Italian regions. As you can see, we have here the mortality rate and here the contraction in value added production, and we have 4 different performances. 5 regions have high mortality and high economic loss, and instead the southern regions have low mortality and low value loss. We think that this model can be useful to allow policymakers and decisors to choose personalized, system-based, long-term valid solution according to the mix of productive activity in such country or such region, and according also to the organization.
Thank you. Brilliant. Thank you.
Yeah. Now, I want to support Michaela on that, and on this idea of what we should do, because you do need national policy. There's no doubt that that's for the guidance, but the application needs to be more granular where the problem is in the regional areas. And I think that one of the things that we fail to look at, this is a public health issue, and public health solutions have been known for centuries. And if you look at the history of the plague, either in Spain or in Italy, in the UK, they did exactly the same things that we are saying now, and that Alberto said at the end when they said you need to have a physical distancing, you need to wear face masks, and you need to self-isolate if you are in contact. And that has not changed over 500 years. The same interventions have not changed. And I think that that's a lesson that we fail to realize, that this is exactly the same as they had in the Black Plague in the 15th, 14th and 15th centuries. And what would happen is cities would close down if they were affected. They wouldn't allow people in, they wouldn't allow people out, and then they would wait until the plague was sorted out via different regions. And that's what lockdown is, actually, exactly the same technique. However, we have not learned from the history that you have to apply it with reason, and in a way where it makes sense to the people to adhere to the actual requirements of a lockdown. And then again, like Michaela has shown in their assessment, is that one can start looking at the economic impact of the lockdown and see how you can make that assessment when you are doing it at the same time. And I really want to commend them in Italy in that paper, which is going to be published very shortly, is that it was the first real attempt to try and do it, and they did it very early on, and this is what we should be doing right now in all the different regions, balancing what is the impact of the lockdown economically and see how it works out where we do it most effectively.
Thank you very much, Peter. I'm going to encourage everyone to make any final remarks they want to make, but Ed Turner has flagged up an interesting question in the Q&A. Basically, he asks, why do there seem to be more people taking part in protests against measures in Spain and Italy than in the UK? And I would add, is that a function of the intensity to which the initial lockdowns were in Italy and Spain compared to the slightly looser arrangements here in the UK? So it'd be great if you might be able to answer that question while making any final remarks you want to make before we head off into the night.
Well,
start with one ahead, yeah.
No, that's okay.
Go for it.
You can go first. No, Michaela, if you want to answer first.
Oh, that's fine, please.
Quickly, I just want to say, I think it's true that it might be a function of the intensity of the lockdown, but let's remember that actually Italy was quite relaxed during the summer. The situation was actually freer than in the UK, since I have both perspectives. So I think also the political environment plays a role. I mean, overall in the UK, I think the government and the opposition and the main opposition party have been quite collaborative so far, and there hasn't been a very confrontational type of politics, surprising for a Westminster style political system. In Italy and Spain, instead, the situation is much more not just territorially, but also ideologically polarized. And talking about Italy, we have very strong populist radical right parties. The main opposition party is a right-wing populist party. I'm not saying that this party is directly responsible for the the negationists or those who deny the existence of COVID-19. But of course, a polarized political environment kind of encourages demonstrations and opposition and mistrust towards institutions. We see that also in the US. I mean, it's another example of that.
Fantastic, David. Mihaela. Mihaela, then Juan Luis.
No, I completely agree. The same things. We have a conflicting information, a conflicting political environment that favors the two different groups, like football teams. We are we are very.
Yeah, understood. Thank you. Juan Luis.
Yeah, I don't know how strong is the protest movement in the UK. I really don't know if there is something out there, but I wouldn't say that in Spain we have a big protest movement against the measures that have been taken, and of course the denial movement is just a tiny part of the disinformation noise that always comes with a huge issue like this. Of course, we have our famous guy saying, I'm not going to vaccine myself or my family. Of course, we have 50 people in the streets in the first week of the lockdown or the curfew a few weeks ago, but it was 50 here, 20 there. Okay. And of course, the police was there. And of course, we journalists were there to record and stream and tweet and amplify that, but it was so short in time and so scarce in people. There is no a movement can be taken seriously, and I'm kind of an expert on social movements, and it is not happening in Spain. Yeah, there is a huge political confrontation between parties. There is a huge political confrontation between governments about the measures that needs to be taken or not taken to preserve health or economy or both at the same time. Are they contradictions or not? Of course, there's a huge polarization, but the Spanish society so far, it is not living the USA mood about the vaccine or about the lockdown, or if we are going to be locked down again tomorrow. I think most of the people will accept it, and the ones that are going to protest out of despair for economic reasons. They are going to say, okay, let's close all the businesses, but give me money instead of my business. It is not a huge denial or even little denial movement growing in Spain. Not at all.
Peter, any closing wisdom?
All I can say is that it's quite interesting living in the UK and seeing that the normal left-right confrontation on this didn't happen. In fact, the left were more for lockdown than the right. And I think where the biggest problem is within the ruling party right now, and the libertarian part of the party is breaking away right now, saying that they don't want the lockdown and don't want the events. So it's finally coming within the ruling party rather than from without the ruling party. So we're going to see that in an interesting way. But it will be quite interesting to look at what happens in Scotland, where there's basically one party ruling the country, which got the majority of the seats and so on. And they haven't had any opposition in that setting. And in Wales, they went ahead with the lockdown ahead of England. But the problem has been in England with the inconsistency of the lockdown. And I think they haven't really worked out how to do the regions. And that's where they're going to get the problem, because the regions want clarity. And I think if they devolved it to the regions, it would be much easier to get away, because in the regions would lockdown as needed. But it's a way to be seen. But it's not a left-right thing in the UK. It's more a right-right, if you want to say what's going to happen in the future.
Yeah. I mean, obviously here we're seeing growing sort of import on social media of some of the narratives from the US, but in terms of street presence, it's been relatively limited. I mean, we had a couple of thousand the other week, but not masses. Okay, on that note, I want to thank everyone who has been on the panel today, and thank you to our attendees and those who asked questions. And please do feel free to share this. The Facebook live feed of this will be available on the Foreign Policy Centre Facebook page. There will also be a SoundCloud version available for those of you who like to listen to it back in audio. Thanks very much, everyone, and have a lovely evening. And stay safe.
Thank you.
Thanks to all of you. Thanks a lot.
Everyone.
Bye.
Bye-bye.